So my name is Stephen Nicholas Housley. I am a physical therapist involved with the Hand Mentor use with the VA. And so I guess we've been using this device for several clinical trials now for several years. My involvement has taken about 3 years. We started off with some controlled trials, not in the home, and then we started to progress into deploying the device in the home of veterans to improve access to rehabilitation. We're finding that the Hand Mentor is a wonderful addition to the care that I provide in the clinic. We're finding that it increases the access to rehabilitation. It makes it easier for our patients to get access to the therapy. It also gives them increased flexibility with the scheduling. So generally speaking, the device is deployed to the home, and occasionally we'll have to go out and actually set the device up, provide some education for the user. So we do initial setup with them, we do training, we do an initial assessment to see how well they're moving in their home, and then we can basically control the parameters on the device. That way it basically mimics and gives them the assistance that they need to help them in their specific way. So one of the benefits of the Hand Mentor is that it actually is very easy to use. It's originally designed to be used without assistance, and so we find that our stroke survivors are able to actually use this independently, or often they're able to use this independently. The device was designed such that there was no complicated donning and doffing process. And the user interface is really quite user-friendly. It's a touch screen. You don't have to be really computer savvy to operate it. It's very user-friendly. We find that people use this in the kitchen, they use this in the living room, basically wherever they're comfortable, wherever they can find a place that they can essentially store the unit and use it frequently. The Hand Mentor, it allows very flexible scheduling. So if we find that you become really busy, family members come over and you find yourself pulled away from therapy, it's very easy to pause the device, and it basically pauses in the therapy session that you would basically be in. You can take care of the activities that you need to, and you can come right back to it. If you find that basically if it was a longer break that was needed, you can easily stop the program and then restart it at some other time during the day. We find that people use the device at sort of odd hours, and so it basically fits their schedule when they're motivated to do it and when they have the free time. So sometimes people will bang out 2 hours a day in one setting, and other times we find that people do 10 minutes at a time, multiple sessions a day. So it's all about that cumulative dose that's really important, and so we're finding that because they're not having to drive to and from the clinic, basically frees up a whole lot of scheduling errors and scheduling conflicts. So they're able to do the therapy comfortably in the home. So the games are a great addition to a traditional physical therapy program. It provides a really interactive environment that allows the user to be engrossed in this really active form of therapy. They don't find that they're really consciously aware that they're actually performing therapy. It just seems like it's fun and games. So they're basically getting the therapeutic dosing that we're finding is really, really beneficial for stroke rehab without them knowing. So they're getting the dosing without them worrying about the total time, and we find that they're actually getting a lot more therapy in the home than they would otherwise be able to get with a therapist solely. So this provides further dosing to sort of augment or improve the actual dosing that they would get in the clinic. So another benefit of the Hand Mentor is that it actually provides really high quality dosing. Oftentimes with therapy sessions, we're constrained to doing a lot of paperwork on the front end and the back end. And so this allows our stroke survivors, our patients, to actually get intermittent doses of really high quality care throughout the day. And so it also is really flexible to adapt to their abilities, meaning if they become too fatigued, they can easily recognize that and then essentially stop the therapy or pause it and restart that later in the day when they sort of gain back some energy. So basically it allows higher quality care. Unlike traditional home exercise programs where you'd be sent home, or I would send a patient home with a piece of paper or a list of exercises to do. This is an interactive environment that basically monitors the activities that they're doing, and it constantly adapts to their needs. And so essentially what the Hand Mentor does is it monitors how well they're moving, the magnitude that they're moving, the velocity of the moving, the kinematics and the kinetics, and essentially sends that information back to the therapist. It sends it back to me. I'm able to monitor that constantly, and I'm able to constantly tweak and refine the therapy that they're getting to best fit their needs and their current abilities. And it allows me then to challenge them to such an extent that it will continue to basically force them to progress. And that's the whole goal here, is to get them to progress past where they are right now. Additionally, because of the data that we're able to see, we're also able to help them with their adherence. We send them home and we want them to do given exercises, certain exercises during the day. However, oftentimes it's hard for me to keep tabs on people if they're just using a traditional exercise program. So what the Hand Mentor allows us to do is allows us to actually monitor on a per second basis. Actually, we sample it's 50 hertz, so we're getting way more data than we need. We're able to see exactly what they're doing and able to see if they are really adhering to the exercise program. It allows me then to intervene if something happens. It allows me to see if something happens from the dashboard, whether or not a family event occurred that they may not have told me. It may give me some insight into how well they're performing or how well they're liking these games, and it helps my interaction with the patient. That way I can help tailor my care to help them. Another one of the benefits of the Hand Mentor is that they're not in this alone, right? They're not at home, they're not just sitting there with their piece of paper doing their exercises. This is a team effort. I'm able to monitor them while they're doing the exercises, and they know that I'm actually able to see what they're doing. And so they have the insight that I'm able to see the gains that they're making, and if they need help, they are able to reach out and ask for help, and we can always modify things. So one of the other strong points of the Hand Mentor is that it actually helps me do my job better. The device can do things that I can't do. It can monitor on a highly specific level the outcomes that the individuals are actually achieving. And so I'm not able to do that myself. And so one of the benefits is that this is not going to actually try to replace me. This is simply to help supplement my care. Some of the patients that I've been working with have described to me improvements in their upper extremity functioning. They're able to use their arms better, use their hands better. They're reporting less depressive symptoms. They've also shown that they've had better access to care, and this is coming out in some of the clinical data that we're seeing. And we're finding that there are improvements in upper extremity scores that happen to be clinically significant. We're seeing improvements also across the board in depressive symptoms. And one of the other benefits of the Hand Mentor is we're treating these individuals in rural areas, in rural environments. And so we're finding that there's improved access to care. So reducing the sort of burden that the therapist or the stroke survivors have to overcome to come into the clinic. And so they're able to perform more therapy, and we're finding that they're actually utilizing the therapy much more. And so the Hand Mentor provides all these benefits. We're able to get really consistent results. And so the individuals, our stroke survivors, are getting the same type of therapy day in, day out. And so that reproducibility of that care is really, really important to me. And it doesn't matter where you are in the country, they're going to get the same dosing that the therapists are prescribing, the same level of care.
If you would like more information on the Hand or Foot Mentor, please visit www.ruralhealth.va.gov.